Hi everyone, welcome back to PrettyWell. Dr. Angela here with you. In this video, we're going to focus on how to treat fibroids. So what are fibroids? Fibroids are generally benign tumors that grow in the uterus, and we don't exactly know why fibroids occur, but there are definitely some theories. Estrogen dominance is one of the theories, that they're very hormone sensitive types of tumors. So, how do you even know if you have a fibroid? Well, sometimes women have no symptoms at all. Commonly, women will have pain, uterine cramping, sometimes abnormal bleeding, like breakthrough bleeding, sometimes really heavy bleeding or periods that just last a really long time. So how do you figure out if you have a fibroid? Well, it's really easy. When you go to your gynecologist, you just have them ask for a pelvic ultrasound. And when they perform a pelvic ultrasound on you, they're able to see with that imaging whether or not you have these types of tumors in your uterus. So what can we do if we find out that we have these types of common tumors in the uterus that many women have? Well, they actually respond pretty well to many basic things. So some of the things we can do are to address hormone balance. And so if you want to know what your hormone balance looks like, you can do some blood testing, some urine testing, some saliva testing from various companies, looking at the ratios of how much estrogen you have, what subtypes of estrogens you have, and what are your levels of progesterone relative to the estrogen. You can take a look at markers that would help you know if you are ovulating regularly or not. So one of the things with fibroids is that they do tend to shrink in menopause. So many women will have fibroids in their younger years when they're cycling, and then as they move into perimenopause and then menopause and total hormone levels fall, fibroids shrink. And some women are, able to get through all of their years without needing any interventions, and it's just fine. But if you are a woman who has fibroids and you're symptomatic and it's coming to, something like you need an intervention and you want to avoid more major interventions like surgery, some of the things you can try, best to definitely work with your local naturopathic doctor, your local integrative medical doctor, somebody who can really monitor things objectively on labs in terms of, how are you responding, how are your hormone levels shifting, and can repeat orders for ultrasounds for you to just make sure that the therapy you're doing is working. But there are really good things to try, things that lower estrogen. And so some of our friends from a dietary standpoint that help lower the levels of total estrogen are the Brassica family vegetables. They're very high in a compound called DIM. You can also take DIM as a supplement. Iodine is also very helpful for estrogen metabolism issues. Fiber is very helpful. Fiber helps us clear hormone byproducts that your liver is working on and trying to help you get rid of, and fiber acts like a good intestinal broom to just help you sweep everything on out. And then it's always a good idea to do liver detox support when we're trying to work on hormone balance, because the liver is the organ that helps us process all of our hormones. So, this can look like amino acids like NAC and glycine, taurine, and then some herbs that can be very, very helpful are herbs that just love up the liver. Things like dandelion, milk thistle, any of the herbs like burdock. Red root historically has been very helpful for fibroids. There's a mixed formula of botanicals called Turska's formula. It's very helpful for treating fibroids. So you can use any combination of those things and then continue to work with your doctor to monitor things and make sure that the issue is resolving. But these can be really helpful treatment approaches that are non-invasive and very safe and very effective at helping to reduce and shrink fibroids. So hope that helps you. If you've used any of these things, if you know friends who have had fibroid shrink, if you've had fibroid shrink and you want to share your stories or what has been helpful for you specifically, please comment below so people can learn together. I will definitely leave specifics in the description box as usual so that you can find products that might be of help and tests that might be of help. And we wish you very good health, and we'll see you back here soon in a week. Let us know if there are topics that you want us to discuss, and please share this video with anybody you think it would help. And like and subscribe to the channel if you want to hear from us regularly and get free naturopathic tips. Thanks. Take good care.